Hello, how's everyone? Today we're going to talk about dental manpower. Whenever people talk about their dental experience or problems, be it mentioning about having a toothache or about a bad visit to the dentist, the person behind it that often comes to the mind is the dentist. Little do we know that other than the dentist, there are actually a variety of dental auxiliaries and other health professionals that provide oral health services. So today we are going to learn about them. At the end of this lecture, I hope that everyone will be able to identify the various categories of dental auxiliaries, generalize at least 3 main duties and responsibilities of each of the auxiliary, and be able to differentiate between the roles of the dentist and the auxiliaries. This will be the content of our lecture. We're going to cover a little bit about who the dentist is, and then who are the dental auxiliaries, dental surgery assistants, dental secretary or receptionist, dental laboratory technician, dental health educator, school dental nurse, dental therapist, dental hygienist, and degrees of supervision of the auxiliaries. For a healthcare system to be successful, it is dependent not only upon the infrastructure and resources, but more importantly, it is the human resource, which are available and whether they are skillful or not. So, the role of a dental team is essential to ensure provision of oral health services that is effective, efficient, appropriate, available, adequate, accessible, and equitable. So, the provision of oral health services will cover promotive, preventive, curative, and rehabilitative. Being a dentist is indeed a noble profession and is looked upon highly by the society. Now, let us look at who a dentist is by profession. A dentist is a person licensed to practice dentistry under the law of the appropriate state, province, territory, or nation, and this varies according to the country. For instance, if you are a dentist in Malaysia, you have to have a license to practice, which means that you have to be registered with the Malaysian Dental Council or MDC. In fact, these days, you also have to complete the compulsory service before you are allowed to practice dentistry in Malaysia. A dentist is also known as a dental surgeon. In fact, a dentist also carries the title DR, but that does not imply that he or she can perform medical procedures. A dentist is a surgeon who specializes in dentistry, the diagnosis, prevention, and treatment of diseases and conditions of the oral cavity. Now, the dentist is supported by a team who aids in providing oral health services. And the dental team includes dental assistants, dental hygienists, dental technicians, and in some states, dental therapists. In the presence of a dental team, a dentist can actually provide service that is not only effective but also be very productive. Now, the supporting team is often known as dental auxiliaries. However, in the United Kingdom, they are better known as dental ancillary. Now, the definition of a dental auxiliary is that it is a person, he or she is a person who is given responsibility by a dentist so that he or she can help the dentist render dental care, but who is not himself or herself qualified with a dental degree. So a dental auxiliary is any of the dentist supporting team who helps the dental treatment. They include dental assistants, known as dental nurses in the United Kingdom and Ireland, dental therapists, dental hygienists, and dental technologists. Now, their role is usually limited by regional dental regulations, which help define the boundaries of treatment that can be performed. Okay, the classification of dental auxiliaries will include the following. There are two main classifications. Number one is the non-operating auxiliaries. This will include the dental surgery assistants or the DSAs, dental secretary or dental receptionist, dental laboratory technician or dental health educator. While the second classification is operating auxiliaries, which will include school dental nurse, dental therapist, dental hygienist, or expanded function of dental auxiliaries. Now, what do you understand by the word non-operating and operating auxiliaries? It simply means that operating auxiliaries are dental auxiliaries who actually perform procedures in the patient's mouth. Okay, our first group would be looking at the dental surgery assistants, or in short, DSA. Now, he or she is a person who assists the dentist or a dental hygienist with his or her clinical work, but does not independently carry out any procedures in the mouth, because as we mentioned earlier, they are categorized as under the non-operating auxiliaries. In some countries, the dental surgery assistants are referred to as dental nurse, so which is lead to some confusion in Malaysia, because we have another category that we call dental nurse. Dental surgery assistant is an invaluable part of the dental team. They are actually the frontliners, and they will usually be the group of auxiliaries who will bring the image to the practice, because they are usually the first to meet patients. Now, they enhance efficiency and productive through sound management, effective communication skills. Therefore, it's very important that DSAs have good effective communication skills, and promotion of patient education is sometimes done by the DSAs. Okay, what are their functions? To be specific, they ensure general smooth running of the clinical area. They're responsible in the management of a lot of things like instruments, equipment, materials, including cleansing, sterilizing, and recycling of this as necessary between patients. That means they look at after the surgery, before and after a patient. They supply instruments to the dentist at chairside as needed, but not legally permitted to do any procedures on patients, against emphasizing on the fact that they are non-operating auxiliaries. Okay, they have a duty to look after the general well-being of the patient. So usually one of the things that they do is, after the dentist has completed a clinical procedure, so the DSA will take over and look after the well-being of the patient before the patient leaves the clinic or the surgery. Now, some DSAs are also given patient reception and appointment making duties and clerical work. This is quite common, and even including the DSAs in Malaysia also function as a receptionist and also gives appointment to the patients. We'll be looking into more detail when we look at the dental auxiliaries in Malaysia. Okay, now what do we understand by four-handed dentistry? It is the art of seating both the dentist and the dental assistants in such a way that both are within easy reach of the patient's mouth. Okay, so you will see that besides the dentist, which is sitting on one side of the patient, on the other side of the patient will be the dental assistants. And this dental assistant will perform additional tasks such as retraction or aspiration, so as to allow the dentist to focus on the working field. Thus, the dentist can work more efficiently with less fatigue in the presence of the dental assistant. Okay, this is a diagram to show the different zones as seen from above when four-handed dentistry is conducted. So if you imagine that this is the face of a clock, then you will realize that the dentist is sitting in the operator zone, which is between 7 to 12. Okay, between 7 o'clock to 12 o'clock. And while the assistant zone is between 2 to 4 o'clock. Okay, and while the transfer zone is between 4 to 7, and the static zone is between 12 to 2, which is also considered like a free zone for the movement of the dentist when operating on a patient. Okay, now the dentist and DSA in a 400 dentistry will sit closely beside the supine patient. The DSAs anticipating instruments and materials that are required will pass them to the dentist in such a way that he may not have even to take his eyes momentarily away from the field of operation when changing to another instrument. So this will ensure efficiency on the part of the dentist. And the DSA must work in a close and coordinated manner with the dentist and must actually anticipate what the dentist will require throughout the procedure. And the operating area must also be well organized and must contain equipments of suitable design. Okay, now next is the dental receptionist or secretary. Now he or she who assists dentists with secretarial work and patient reception duties, particularly when the surgery or the clinic does not have DSA who works as a receptionist. That means to say that the DSA would just focus in the clinical area or in the surgery. Now, the functions of a dental receptionist or secretary would be to handle the patient crowd by guiding appointments after consulting the dentist. And she may have some knowledge of materials used in the clinic and also responsible to maintain the book of account and keeping all the bills. Okay, next is the dental laboratory technician. Now, he or she is a person who works in the lab. And what does he do? He constructs dental appliances according to the prescription of the dentist. In Tasmania, laboratory technicians are legally permitted to work directly with the public to provide a prosthetic service. Okay, in Malaysia, this would be illegal. And dental laboratory technician may also be employed by dentists in private or public health practice. However, they may also be self-employed and accept work from dentists in the area. Okay, in Malaysia, we normally call them dental technologists. Okay, how about the oral or dental health educator? Okay, they have an important role within a dental practice, and as their name sake, is to promote a good oral health care and work with patients to prevent oral diseases. They could also go out into their local communities, which means that they can also provide their service outreach, take their oral health messages to members of the public. They must have excellent communication skills because it is essential for their role to be effective. They may also be permitted to apply preventive agents intraorally. Okay, now the school dental nurse. Specifically, the school dental nurse in New Zealand. Okay, it was established in New Zealand, this group of dental auxiliaries, in 1923. Due to the high oral disease burden among school children at that time in New Zealand. Now, their role is to examine, to diagnose and to treat most of the prevalent oral diseases, which includes the dental caries and the periodontal diseases. They also prepare cavities and restore teeth. They extract deciduous teeth, and they also conduct scaling and tooth polishing. Now, the school dental nurse New Zealand is very much like our dental nurses. And in fact, the establishment of the dental nurses in Malaysia is very much according to the school dental nurse in New Zealand. Okay, besides that, the school dental nurse in New Zealand can apply topical fluoride. They also provide dental health education and refer a more complex case to the dentist in the area. They are allowed to give local infiltration anesthesia, but not allowed to do block or to perform block anesthesia. Okay, there is another group of dental auxiliary, very much similar to the school dental nurse New Zealand, which is known as a dental therapist. Now, this is a person who is permitted to carry out, to the prescription of a supervising dentist, certain specified preventive and treatment measures. So they are working under prescription. Now, their function includes clinical caries diagnosis. They can do cavity preparation. They handle material and have skills in restoring teeth. They also allowed to perform vital pulpotomy, extraction of deciduous dentition. They are able to interpret X-rays, as well as also permissible to take radiograph. Okay, the dental hygienist has a function which is slightly different than the dental therapist. They are first employed in the private dental practice in USA in 1906, and in 1913, the first formal training course for hygienists was established. Now, what do? A dental hygienist does scaling and polishing of teeth. They apply topical fluoride. They provide dental health education. And in some countries, they are also permitted to take radiographs, even make impressions for study models, and polish restorations. So these are another group of dental auxiliaries which are actually under the classification of operating personnel. Expanded function dental auxiliaries are also known by several names, such as expanded function dental hygienist, expanded function dental assistant, expanded function auxiliary, or expanded duty dental auxiliaries. It simply means that there are some dental auxiliaries who are given or expanded function, and they have to undergo special training of certain procedures, which following the training they are allowed to perform those procedures. So examples of such procedures would be placing and removing rubber dams, placing and removing temporary restorations, placing and removing matrix bands, amongst some of the procedures that is shown here. And usually, apart from the dental assistant, most of the dental auxiliaries who are given expanded function are usually those belonging to the operating dental personnel. Frontier auxiliary is another type of auxiliary that existed in the United States, and they are usually available in the frontier regions, which are sparsely populated, with social and economic barriers, but it's in need of dental care. And usually the frontier auxiliaries are nurses and former dental assistants. They, in such areas, may provide valuable services with minimum training before referring to the nearest dentist. One of the few procedures that are allowed for them to perform would be simple dental prophylaxis, provide basic dental education, give advice on dental emergencies, and render dental first aid in cases with pain. Some countries have an acute dentist shortage and have no facilities for training dentists. And also with the realization that training dentists can be very expensive, in such situation, a decision must be made as to who should provide the dental care for the population, at least to provide emergency care, until the patient can be referred to the dentist. So the Expert Committee on Auxiliary Dental Personnel of WHO has suggested two new types of dental auxiliaries, which are the dental licentiate and the dental aide. So dental licentiate is a semi-independent operator who functions to provide dental prophylaxis, cavity preparation and fillings of primary and permanent teeth, extractions under local anesthesia, drainage of dental abscesses, and early recognitions of more serious conditions. While the dental aides would include duties such as elementary first aid procedures for the relief of pain, extraction of teeth under local anesthesia, control of hemorrhage, or referral. So these two new dental auxiliaries could actually provide basic emergency care to the population before a referral can be made to the dentist. Okay, now let us now look at the degrees of supervision of a dentist. Even though the dental auxiliaries to a certain extent are independent or have personnel, but we must remember that they are always subjected to the supervision of the dentist. So in 1975, ADA defined 4 degrees of supervision of the auxiliaries with the assumption that ultimately responsibility will be assumed or must be assumed by the licensed dentist. So there are 4 types of supervision: general supervision, indirect supervision, direct supervision, and personal supervision. Now let us look at the degrees of supervision one by one. In general supervision, physical presence of the supervising dentist is not required during the performance of the procedures. So, in other words, the dentist need not be present while the procedures are being performed. However, the dentist has to authorize the procedures. Before that, in accordance with the diagnosis and treatment plan completed by the dentist, only can the procedures be performed. And the dentist must also personally authorize the procedures and will evaluate the performance. With respect to direct supervision, the dentist not only examine the patient, personally diagnose the condition to be treated, personally authorize the procedure to be performed, but he or she has to be present physically in the dental facility and must be available when the procedure occurs, and before dismissal of the patient, evaluates the performance of dental auxiliary. And one of the important features here is also the supervisors has to take full responsibility for the completed procedure. Okay, what is the difference then between direct supervision and indirect supervision? With respect to indirect supervision, the dentist or the supervisors remains in the dental office while the procedures are being performed by the auxiliary. However, he need not be physically present. So that is the difference. Okay. Prior to performance by the dental auxiliary, the dentist or supervisor would have authorized the procedure, would have personally diagnosed the condition to be treated, and he must evaluate the procedures once it is completed by the auxiliaries. In personal supervision, the dentist is personally operating on a patient and authorizes the auxiliary to aid treatment by concurrently performing supportive procedures. Because the dental auxiliary is concurrently performing the supportive procedures, this gives an opportunity to the supervisors to conduct personal supervision. We have discussed about the dental auxiliaries in other countries. Now let us look at the dental auxiliaries in Malaysia itself. Now even in Malaysia, the dental auxiliaries are categorized into the same group, which is the operating dental auxiliaries and the non-operating dental auxiliaries. The following are the dental auxiliaries which are in Malaysia, namely the dental therapists, dental technologists, and dental surgery assistants. And out of these categories, only the dental therapist is being regarded as the operating dental auxiliary, while the other two groups, which is the dental technologists and the dental surgery assistants, are categorized under the non-operating dental auxiliaries. The first dental auxiliaries in Malaysia that we are going to discuss would be the dental therapist. Now, the practice of dental therapist is regulated under the Dental Act 2018, which is Act 804. Now, let us look at their roles and functions. Number one would be they may carry out procedures under the fifth schedule, which would be clinical procedures on persons below the age of 18 years. And here are listed the procedures that they are permissible to do, such as oral examination, class 1, 2, 3, and 5 restorations, which are direct restorative materials, administration of local infiltration anesthesia, extraction of primary teeth, placement of facial sealant, application of fluoride gel and paste, and supragingival scaling and polishing. They also provide dental health promotion, education, and instruction, and allowed to take intraoral photography on instruction of the dental surgeon. Now, in the public sector, they are under the supervision of the dental surgeon in public sector. However, in the private sector, the dental therapist must be under the direct supervision of the dental surgeon at all times. As such, they are not allowed to work without any supervision. So these pictures of some of the job scope of a dental therapist in Malaysia. Just for information, the name dental therapist was installed only quite recently, and prior to this group of dental auxiliaries were known as dental nurses. Okay, the second category of dental auxiliaries in Malaysia would be the dental technologists. Now, dental technologists are responsible for designing and processing prosthetic, orthodontic, and maxillofacial appliance. They also repair and maintain the dental equipment. And the dental technologists are regulated under the Allied Health Professionals Act 2016 or Act 774. So they are not regulated under the Dental Act. Okay, the third group would be the dental surgery assistants, or fondly known as DSAs. Now, they assist the dental officer or the dental nurse in management of patients. In this case, what I mean is the dental therapist. Now, they're also responsible for infection control in the dental surgery. They also register patients and collect payments from patients and issue receipts. They also manage the patient's records. Okay, so in summary, I would like you to try and answer the key questions that I've put here that may also aid you in doing further reading about the dental auxiliaries in answering the questions. So number one would be, what impact will the dental therapists employed in school-based programs have on reducing access disparities? How do they complement the work of a dentist, especially in countries where the number of dentists is experiencing acute shortage. Okay, number 2, should the dental technologies in Malaysia be regulated under the Dental Act 2018 instead of the Allied Health Personnel Act? This is just an open question for you to think about. Number 3, outline the rationale for training of dental auxiliaries and their impact on the dental delivery care system. So I think this is an easy question where you just need to give reasons as to why do we train the dental auxiliaries, and having trained them, what will be their impact on the dental delivery care system? Will having them improve efficiency, improve productivity, or how will it affect the job scope of the dentist? And the 4th question is, relate future roles of dental therapists in Ministry of Health, Malaysia, with the influx of dental officers in recent years. So this is also a question that will hopefully initiate your mind to think, because as we all know, in recent years there is an influx of dental officers, especially those working in the ministry. And how would this affect the future roles of the dental therapists? Okay, so in conclusion, dental auxiliaries have the responsibilities of providing high standard of services to their patients, and they should assume their duties freely and voluntarily. That means even if they are dental auxiliaries, they play an important role as part of the dental team in making sure that we continue to provide high standard of services to our patients. Effective use of the allied dental personnel increase output per dentist and net incomes, as we have discussed before. That means they will affect the efficiency, the effectiveness, as well as the productivity. Now, by employing dental auxiliaries will increase the capacity to see more patients. As I mentioned, definitely it will increase productivity when we can see more patients. These are the references used for this lecture, and I hope you will do some reading in at least a few of them to have a better understanding. Okay, so we come to the end of our lecture, and I would like to thank everyone for your attention, and please, as usual, do further reading as it will enhance your understanding. Until then, bye-bye.